Bismillah ar-Rahman ar-Rahim. Today we'll start our lecture number 8, and inshallah this is the final lecture of bacteriology part 1. Today we're going to continue the last organism under the acid-fast bacteria, which is Mycobacterium leprae, and then we're going to take very briefly the group Actinomycetes and Mycoplasma. Mycobacterium leprae. This is of course the causative organism of leprosy اللي هو بالعربي اسمه مرض الجذام, and it was formerly known as Hansen's disease. Leprosy معناها in Arabic means المنبوذ. So it shows us that this disease, as we will see in its epidemiology, the patient acquired this disease was excluded from the society وأصبح منبوذ, وده من ضمن الأسباب اللي هنشوفها إن ما حصلش a great spread of the disease between the society. Hansen's disease. Hansen is a name of a scientist who was the one to discover the organism causing this disease. Morphology and characteristic. Morphology is similar to Mycobacterium tuberculosis. It's also an intracellular bacterium. برضو it needs a very long time to grow. So it has the longest generation time, even longer than of Mycobacterium tuberculosis. الحاجة السبيسيفيك لها أو characteristic لها إنها grows best in cool tissues, and it has never been cultivated in artificial media or cell cultures. And we will see that it has to be cultivated in an animal. This is Hansen, Dr. Nirwigi, a first scientist isolated the Mycobacterium leprae. Epidemiology. Leprosy is probably the most feared chronic disease. It began in India 600 years BC, يعني قبل الميلاد ب 600 سنة. It's a very old disease. It was believed to be carried to Europe by the soldiers of Alexander the Great. اسكندر الأكبر هو عن طريق الجنود بتاعته اللي راحت تفتح في هند أو تحتل الهند, فنقلت this organism from India to Europe. Leprosy became a common disease in Europe during the so-called Dark Ages. Dark Ages اللي هي العصور المظلمة اللي ما كانش فيها طبعا علم كتير, كانش فيه knowledge about of course microorganisms, ما كانش فيه science عموما, was very primitive يعني. But it disappeared. ورغم ذلك it disappeared from Europe afterwards very quickly. ما قعدتش مدة طويلة في أوروبا. Why? Due to the rigid isolation of the patients. لأن patients with leprosy were rigidly excluded, يعني مستبعدين from the normal European society. ليه؟ لأن الناس كانت بتخاف من المرض, بتخاف من الإصابة بهذا المرض, فكان لدرجة sometimes even they let this patient wear a bell so that people could avoid them. يعني يلبس جرس في رقبته بحيث ان اول ما يجي يشخلل المريض, اول ما يسمعوا صوته يطلعوا يجروا ويهربوا منه. فده طبعا ادى الى ان المرض اختفى من اوروبا بسرعه. Today leprosy is found worldwide and it affects about 12 million individuals, but commonly in the south areas. فبنلاقيهم in the South Africa, South America and South Asia. But patients are now no longer kept in isolation. زي الأول, كان الأول بيبقى فيه مصحات مخصوصة للجذام, ومريض الجذام ده بيبقى منعزل, بيعملوا له isolation تامة. Strict isolation was done for patients of leprosy long ago. But من ساعة ما اكتشفوا السلفون drugs أصبح this الحاجة إن احنا نعمل isolation قوية قوي للpatients قلت. So here this sentences say, but patients are now no longer kept in isolation as they can be made non-communicable within few days by the sulfone drugs اللي هو زي الدابسون يعني. Children appear to be more susceptible than adults and males than females to get the disease. To acquire the disease, children more susceptible and males than females. Mode of transmission. Although it is a very fearable disease, as we said, but to our knowledge, it's not a highly communicable disease. It's not like Mycobacterium tuberculosis. لا, هنا for this infection to occur, أولا لازم الشخص يبقى عنده ما عندوش مناعة كويسة برضو. فnormal persons with efficient cell-mediated immune response probably cannot be infected by any means. Okay, يبقى الشخص اللي عنده good immunity, he will never get this disease. Only susceptible persons. وكمان after prolonged skin contact or by the nasal discharge in the case of Lepromatous leprosy اللي احنا we will explain it now, can acquire the disease. يبقى لازم يبقى في prolonged skin contact between the skin of the patient and the person who is liable to get the infection, or by the nasal discharge. يبقى these are the two ways of infection, modes of infection. Some believe that transmission may occur via the placenta or through the breast milk. يبقى معناها إن ممكن المother to تنقل infection to her fetus or to her baby while breastfeeding. The clinical picture, the incubation period, as we see here, is very long, from 2 to 15 years. It may reach to 26 years. But that due to what? The very slow growing of the bacteria. There are two major forms. The most mild form, we call it tuberculoid leprosy, and then we have the very severe form, اللي هي Lepromatous leprosy. In between, there are other levels of infection, but we're not going to deal with it to make it more brief, okay? Tuberculoid leprosy, they call it the anesthetic form. It's a self-limiting disease. It affects part of the skin. Mainly, the infection of the leprosy is in the skin, okay? So here, as we see in this picture, this patches, this white patch in this girl's arm appears, as you see here. So we're going to speak about it now. A self-limiting disease. It affects part of the skin where lesions occur. Then it attacks in nerve endings, producing areas of anesthesia. And this is mostly the sensory nerves. Why? Because the cell-mediated immune response هي اللي attacks the infected nerves. يعني الأورجانيزم بيبقى موجود in the nerves. immune system attacks the nerve وهي اللي بتسبب الأنستيزيا. إن الشخص he doesn't feel the touch or pressing on this area. يعني الاريا دي بتبقى lost its sensation by heat or by touching or by pressing. It doesn't feel any sensation. The organisms are extremely rare in the skin scrapings in this condition. بيبقى عدد الorganisms is very rare. Lepromatous leprosy is the most severe case. It's a progressive malignant form. They call it progressive malignant form. If untreated, it ends in death. Actually, death is not due to the leprosy itself, but it may be due to any other secondary infections like tuberculosis can occur, وهو اللي بيكون السبب, the real cause of death. The organism is found in every organ of the body في حالة Lepromatous leprosy, although the major pathologic changes برضو occurs in the skin and the nerves. فيبتدي يظهر على skin nodules. May also affect the skin nodules or the mucous membrane of the nose, causing the nasal deformities. يبتدي يحصل تشوهات في المناخير. The nose changes its shape. يحصل لها إنها بتفطس لجوه كده. The eyes is usually infected and this causes blindness. بيبقى فيه invasion of the larynx and we find that the patient's voice will change. As you see in the picture, the skin of the face and the ear lobes become so thickened by edema giving the leonine appearance. يعني the patient's face appears as if he is a lion, زي ما يكون شكله أسد. بيحصل كمان deformation of the hands, and the person can't open his hand well, so it appears as closed, تبقى زي مخالب الأسد, due to the necrosis and the damaging of the tissue of the extremities. And parts of the fingers even may fall down, as we see in the next picture. From this very hard symptoms, of course, people long ago feared very much of this disease. وكانوا بيعتبروا ان الشخص ده ربنا غاضب عليه لان هو he made lots of sins, عمل خطايا كتير قوي, ف God is very angry from this person وهو اللي changed his shape like this. Of course, they didn't understand that this is due to a microorganism. So that's why the old people in the dark ages, they were very fearful about or from the persons acquiring this disease. Here, a Lepromatous leprosy, again we will see the face with changes in the voice of the person, and his hands, as you see here, they are like claws, زي مخالب الأسد, and parts of the fingers, as you see here, has fell down from necrosis. Laboratory diagnosis: acid fast stained films from scraping of the nasal septum or from the skin. Cultivation, as we said, it must be done in an animal, so in the footpad of mice, because the footpad of mice يعني في الكف ايدين الفار بتبقى حرارتها low temperature, فلازم الحاجة اللي ينمو فيها this organism has to have very low temperature from 30 to 35 degrees centigrade. So long ago they cultivated on the footpad of mice, and now they discovered this animal, which is called the armadillo, because the body of this animal has this temperature, so it serves as a good source of lepromine. With this word lepromine is analogous to tuberculin. And there is also a lepromine test which can be done for diagnosis. It is analogous to the tuberculin skin test, but here it only gives positive in the tuberculoid type, اللي هي the most mild form of the disease. So it indicates a degree of immunity to leprosy. It is not useful in the case of Lepromatous leprosy. Here, this is the shape of the armadillo, اللي هو الanimal, which can be used for cultivation of the leprosy. Prevention and control: isolation of the infected person, especially infants from lepromatous parents from birth. BCG vaccine بتاعت tuberculosis showed some protection against leprosy in children. So the vaccine converts also the lepromine negative to positive. Of course, efforts are underway to develop a leprosy vaccine, but until now there is no available vaccine for leprosy. They only give this BCG vaccine for children. Treatment: daily administration of rifampicin for 3 to 6 months, accompanied of course by dapsone, اللي هو sulfone drug, for 10 years or even for lifelong. Actinomycetes. This group of bacteria is called fungi. They are fungi-like bacteria. Although they are prokaryotic organisms, like any bacteria, they are prokaryotic, not like the fungi, which is eukaryotic. They form branched filaments of cells similar to fungi. And from here, they are fungi-like bacteria. They form mycelia, branched filaments, and mycelia and spores like the fungi. Medically important actinomycetes, we're going to take 2 small examples. Actinomyces israelii, which cause the disease known as actinomycosis in humans. This organism is a normal flora of the oropharynx and sometimes in the intestinal tract or even in the lungs. So it is believed that trauma, يعني the beginning of the infection, must happen a trauma, لازم يحصل a trauma or dental surgery or ulcers to begin the infection, or even a diseased appendix. in the GIT. This begins the infection because it's a normal flora. فالكونديشن العادي مش هتبقى بتسبب أي infection أو أي disease، ولكن لما يحصل فيه trauma, dental surgery, as we said, ulcers and so on، يبقى بيحصل إيه؟ يحصل تبتدي الانفكشن. Actinomyces cause destructive abscesses. يبقى هي أساسا بتعمل destructive abscesses of the connective tissues which may be. ده هنا اختلاف المكان بتاع وجودها على حسب النورمال فلورا موجودة فين. فلو موجودة في ال cervicofacial actinomycosis يبقى هنا هتبان in the face and in the neck، ودي بتمثل 30 to 60% of the cases. Abdominal actinomycosis بتحصل في السيكم and the appendix، وبرضو it is up to 50% of the cases الحالة دي بتبقى. Thoracic actinomycosis اللي هي بتحصل في اللنجز والشست دي about 20% of the cases. طبعا it's not important for you to know these يعني percentages عشان اسهل لكم الموضوع، مجرد ان احنا نعرف بس ان في 3 sites of infection. The lesions may extend to infect various internal organs، يعني مش بس الثلاثة أماكن دول، لا دي ممكن كمان يحصل لها spreading وتروح للليفر, urinary system, spinal column, causing برضو destruction of the bones. Laboratory diagnosis identifying sulfur granules. ايه هي sulfur granules؟ دي عبارة عن colonies, clusters of colonies، بس بيبقى لونها يالو زي السلفر، فعشان كده بيسموها sulfur granules. It is present in the purulent exudates. So the granules are crushed and stained to show the typical gram-positive branched filaments. As we said, it always form filaments, as well as the bacillary and coccoid forms of the organism. This organism is cultivated anaerobically on brain, heart infusion, blood agar plates. Treatment and control, penicillin G or ampicillin, but it needs a long period of medication from 12 to 18 months. Alternatively, we can use doxycycline or cefotriaxone. Very important control of good oral hygiene. The second example of actinomycetes is Nocardia astroides. This is an opportunistic pathogen that causes nocardiosis in immunosuppressed patients. بما أنها opportunistic يبقى إذن only occurs when there is a ضعف في المناعة. Patients will inhale airborne spores or fragmented mycelia, and the nocardia will multiply in the lungs and give rise to a pulmonary disease very similar to tuberculosis. وهنلاقيها إنها دي من ضمن برضو البكتيريا which contain mycolic acid. We have 3 organisms containing mycolic acid. مروا علينا دلوقتي. We call them in our diphtheria lecture is CMN group, which was Corynebacterium diphtheria, Mycobacterium tuberculosis, and Nocardia. These 3 organisms contain mycolic acid, and that's why here we'll see the pathogenesis of this organism is very much similar to tuberculosis. Also from the lungs, the organism may spread to brain or kidney, but they do not cause bone destruction as the actinomycetes اللي هي لسه كنا بنتكلم عنها. Nocardia astroides can also cause chronic subcutaneous infections referred to as mycetoma or Majora foot. وهنا الشكل الصورة دي this is the lesions اللي بتحصل في الماجيورا foot due to this organism. Laboratory diagnosis. Gram stain appear as long branching gram positive filaments. As we see here, they are filamentous organism. And also fragments of bacillary bodies which show partial acid fast. if we يعني نقدر نسبخها بالacid fast stain بتدينا برضو partial acid fast. easily grown aerobically on mycobacterium or fungi media. Treatment control is impossible. We can use sulfadiazine, trimethoprim, sulfamethoxazole, or cefotriaxone. Okay. Finally, we're going to speak about mycoplasmas. These are the smallest prokaryotics capable of living outside the host cells. يعني بمعنى they are not intracellular parasites. They can live outside the cell, but they lack a cell wall. ودي الحاجة very characteristic المجموعة دي إنها lack a cell wall. So of course we know that the cell wall gives the rigidity of the cell. فلما بيبقاش في cell wall هنلاقي شكل الأورجانيزم هيبقى pleomorphic. So this organism will have different shapes. It will not have one shape because there is no this cell wall structure. So they form ultramicroscopic coccoid cells. They can appear as cocci or long filaments. And these filaments can be branched or unbranched. The example this is not the first example, it's the only example we're going to take actually, Mycoplasma pneumoniae. It is the causative agent of primary atypical pneumonia. Why do they call it primary atypical pneumonia? The word primary, of course, means it's a primary infection. Yani the patient is not suffering from any other respiratory infection and he is going to contract this organism and cause the infection. So it is a primary infection. It is atypical pneumonia because it is not like the usual kinds of pneumonia we have studied before. All the other pneumonia can be treated by penicillins. But this organism cannot be treated, of course, by penicillin from your knowledge because of the lack of the cell wall. لأن طبعا cell wall is the main target of the penicillin. So that's why they call it atypical. The word atypical comes from this point. This infection is not rare. It can cause 1/6 يعني سدس حالات pneumonia can be due to this organism. So it is a common kind of pneumonia, but it's a mild kind of pneumonia لدرجة they call it sometimes walking pneumonia. بمعنى it means that the patient can live normally without staying in bed because the infection is mild, and even it can be recovered without antibiotics. But however, there are sometimes it is severe, and we have certain, of course, severe cases may occur with chest infiltration and coughing, which may persist for 1 or 2 months, but it is rarely fatal. In laboratory diagnosis هنا في 4 steps, but we can only يعني كفاية عليكم to know the first step. أحاول أخفف عليكم. By cultivation on rich media زي blood agar, you can see the colonies which produce a very characteristic appearance, which we call it a fried egg appearance, as you see here in this picture. Fried eggs يعني شكل البيض المقلي. ده طبعا شكل الأورجانيزم اللي احنا قلنا عليه بيبقى coccoid or filamentous, branched or unbranched. Prevention and treatment, avoid contact with patients. And number 2, tetracycline and macrolides. طبعا we can say penicillin here. So we have to have alternative treatment by tetracycline or macrolides such as clarithromycin or azithromycin. And by this, we reach to the end of bacteriology part 1. I wish you good luck and thank you وإن شاء الله بالتوفيق بإذن الله.